Okay. Good afternoon, everyone. Happy New Year. Bonjour, Quay. Today we have with me Dr. Morrison. I have Minister Natalie Jamieson, who is joining us online virtually, and will provide us a little bit of an update on our back-to-school plans. We will also have Norbert Carpenter from the Public Schools Branch and Gilles Arsenault from the CLSF on the line as well, if you might have some technical questions about from a school perspective as well. We're here, of course, to give the most up-to-date briefing on COVID-19 in our province and what we anticipate in the days and weeks ahead. Before Christmas, we put in place restrictions that were to last until January the 8th. Dr. Morrison will speak more about these in a moment, but we will be extending those restrictions in our province until January the 17th. We will also be making an announcement regarding schools, extending the online learning a little bit longer with a plan and hope to return within class learning on January 17th, and Minister Jamieson will provide more details on that in a moment. Just before I turn it over to Dr. Morrison, I wanted to just speak directly with Islanders and just to share a little bit of perspective. This isn't our first COVID challenge. On this long and arduous journey, we have faced many fears and many unknowns, and we have proceeded through them all using science and the most up-to-date health information and research at our disposal at the time. And at every junction, we have, though there have been differing views on how we should proceed, we are fortunate and grateful that we have made it until now. And where we are right now, we have led the country in our response, and that is in less of a situation that we find ourselves in. We're in this because we've used consistent, data-driven approach, and it's served us very well. And as we face this latest challenge and what we hope might be our final challenge, we remain committed to following that approach that has served us so very well. From the beginning, we have done well fighting COVID as a province and as individuals. That is because we have done what we've been asked to do, and by understanding that situation we find ourselves in today, we knew we were in a good starting place for the arrival of the Omicron variant in the province. Even though it arrived sooner in the country and in the continent and in our province, it arrived a little sooner than we had anticipated. We knew at that time when it did arrive that case counts would climb, and they have. But because we lead the country in vaccinations, because we adhere so closely to health protocols, because we have put in place strict restrictions fast and when we've needed to, the results have been so far what we have anticipated and hoped for. That you may test positive, but you're going to be okay. Now, I don't want to diminish the fact that we have people who have contracted COVID in this province. I'm told by some that it knocks the stuffing out of you for a couple of days. It's not nice. They have been sick. But to date, we've only had the 3 hospitalizations, and that's a good thing. I do want to offer my best wishes for a speedy recovery to all who have tested positive and are dealing with their illness right now. We remain hopeful that we will continue to see these trends in the days and weeks ahead. But what we know about COVID, and particularly the Omicron variant, is what we don't know. If we do need to make changes, if outcomes and patterns change, we will adjust our plan as we have throughout. And as Premier, I do say that I have great confidence in the plan that has been built, because it has been built by Dr. Morrison and the staff of CPHO and all of the health departments across P.E.I. based on the best information that we have at this time. At the same time, I know that Islanders are frustrated. I share that frustration. I've said that before. I would say it again. This has been a long grind. I know that it's very hard, particularly having gone through 21 months or so. It's difficult for us right now to see and hear some of the numbers of cases that we've heard. Numbers like 161 and 175, they certainly get our attention. Our tendency has been to fear the high numbers, and unlike every other jurisdiction in the country, we have avoided those numbers until just recently. But I would reiterate what I said on the last briefing and what Dr. Morrison and others have been saying, is that though our case numbers are higher, so far, aside from the 3 hospitalizations that we have announced, we are seeing islanders with some sickness, but overall doing okay. And as I say, we're hopeful that continues. I would again like to ask islanders for their understanding and compassion for those who have contracted the virus. Overall, most of us have been very careful. We've done everything that we could do not to come into contact with the virus. But Omicron is proving to be a little bit different. It's highly contagious, and people who have done everything that they have been asked to do right down to a T are testing positive. It's frustrating, I know that, but let's not wrongly assume that someone who has been positive has been flaunting the rules or not obeying the public health protocols. I spoke to someone this morning who was frustrated and upset. She told me that she was double vaccinated. She was going in for a booster later this month. She wears a mask everywhere. She keeps her contacts small. And her comment to me was, I feel like that was all for nothing. And my response to her was that I think it was for everything. And the reason that so many of us have done those very things are the very reason that we are able to weather this storm to date that we've had, and it gives us the confidence that we're able to continue to weather the storm until we're through to the other side of it. We've done that together, and that's going to be our way forward. And finally, before I send it over to Dr. Morrison, I want islanders to know that we're also working on a plan to begin to move back again to some kind of normal. It's not our intention to stay in this strictly restricted situation for any longer than we need to. Some have asked when and how we get out of this. The when will be determined, as it always has been, by the science and the best information that we have. The how, that is what we're working on, and it won't be waiting for case counts to be zero. In that regard, it will look a little different than some of our previous paths back to normal have been, but it will include continued screening and monitoring, continued testing, including at-home rapid tests when we can apply them. It will involve islanders getting their boosters when they're scheduled to get them, and will for the adherence to many other measures that have become part of our everyday lives. But I do know that we will get through this, as we have countless times before. We are still in a very enviable situation. We monitor this very closely, but we feel like we're on the right path. And with that, I will turn it over to the person who's helped us stay on that path, Dr. Morrison.
Thank you, Premier, and good afternoon, and thank you for joining. And I know, thank you. Special thanks for those joining online as well. As the Premier mentioned, we'll talk about the COVID situation in P.E.I. and the back to school and the extending the current public health measures, a little bit about the vaccine rollout and rapid tests. There will be another briefing on Thursday, at which time we'll talk more about masks, isolation and case management guidelines, and the test to stay policy. In Canada, there's been an increase of 79% in terms of the number of cases compared to the week prior, and an increase in hospitalizations nationally, 23% compared to the previous week. As of 8 o'clock this morning, there are 198 new cases of COVID-19 to report, bringing our total active cases to 1,159. Over the last 7 days, we've had an average of 138 cases per day. As the Premier mentioned, there are 3 people in hospital being treated for COVID-19 and 1 person in intensive care. 4 additional people are in hospital and have COVID-19 and are being treated primarily for illnesses other than COVID-19. So COVID-19 is not the reason for admission. Similar to the rest of the country, in the last week, 67% of the cases were in individuals between the ages of 20 and 59 years of age, and 17% of our cases were in youth under the age of 10 years. In the last week, there were over 15,500 COVID-19 tests completed, 1,450 PCR tests, and the remainder were ID Now molecular tests conducted at health P.E.I. testing clinics and points of entry. And this is an increase of 12% from the previous week. Like all provinces, we are in the midst of an aggressive fourth wave of this pandemic, and we are seeing the Omicron variant spreading at an alarming rate. Many areas of our health system are being strained with higher case counts. This wave is affecting many parts of our economy and life here in P.E.I. It is not known when we will reach the peak of this wave. Based on the experience in other countries, we can anticipate a sharp rise and an equally sharp drop in cases. And I think here in P.E.I. what we can try to do is manage maybe how high that peak goes and how fast it rises. And I wish I could predict with certainty when we will come out of this wave. I cannot do that, but I echo the Premier's remarks that we will weather this storm and remain hopeful as we get out the other side. Until we know more about the extent of spread of Omicron in our province, we are compelled, though, to take a steady and cautious approach. We must continue to work together to limit the spread of Omicron variant. In December, additional public health measures were put in place until January 8th, and the Premier and Cabinet accepted the recommendation to extend all of these measures until January 17th, including the following. Personal gatherings are limited to 10 people, and island residents are asked to keep close contacts to a steady and consistent 10 people. A smaller circle is better, and I heard Newfoundland refer to it as a tight 10. Wedding receptions and funeral receptions and wakes are not permitted. All organized gatherings, including worship services, theaters, wedding and funeral ceremonies, and concerts, must operate with a maximum of 50 people with physical distancing between households. Multiple cohorts are not permitted. Gyms, fitness facilities, and retail can continue to operate up to 50% capacity with physical distancing and masks. Visitation to long-term and community care is limited to 3 partners in care plus 3 designated visitors with physical distancing. Physical distancing is required in all venues up to a maximum of 50% capacity in retail businesses and VaxPass events, including theaters, gyms, community gatherings, and casinos. Restaurants and eating establishments must maintain 6 feet distance between tables, maximum table size of 10 people, with proof of vaccine for all patrons, and masking at all times except when eating or drinking. Food premises and eating establishments must stop food and beverage service at approximately 11 p.m. and close by midnight. No dancing at events and no karaoke. Indoor sport and recreational activities continue to be paused for island children under the age of 12 years, including organized sports, tournaments, competitions, games, team training, and practices. League play and practices for individuals over the age 12 are also paused. Whenever possible, employers should support employees to work from home. Our ability to begin easing these measures will depend on the impact of this wave in the coming days, including serious illness and hospitalizations. As we discussed last week, case numbers are an indicator of an impact. However, given the growing number of cases and the likelihood that case counts are considerably underestimated, the rate of hospitalization and the need for intensive care are better indicators of the impact of this wave of COVID-19. The CPHO has prepared back-to-school guidance, recommending a further delay in the opening of public and private schools to in-class learning until January 17th, based on an assessment of the situation next week. The return to in-class learning will depend on our epidemiology and the ongoing impact of Omicron and P.E.I. This was a challenging decision that was based on balancing safety overall health and well-being of children. We know how important in-class learning is for children's physical, developmental, and mental health and learning. We know the very best approach is for children and youth to be in school. Given the reality of our uncertain situation with COVID-19, we need more time to better understand the impact of COVID-19 on all age groups, including children, and to take steps to ensure a safer return to school. We cannot stop the Omicron variant among the population, and the best we can do is to slow it down. School environments are no different. When in-class learning resumes, there will be cases and outbreaks of COVID-19 in school settings. The back-to-school guidance for January 2022 includes public health measures to minimize the risk and disruption and increase safety in schools when students and staff return to in-class learning. This guidance builds on the August 2021 back-to-school guidance. Some measures contained in the CPHO school guidance for 2022 include masks will be required for all students, teachers, and visitors in all indoor areas. Children and staff should have access to a good quality 3-layer mask. Prior to resuming class, all students and staff members will be asked to take 2 rapid antigen screening tests 48 hours apart, and students will be tested up to 3 times per week during the first few weeks of school. Students and staff must complete daily home active screening for symptoms and should not attend school if they are not feeling well or have symptoms of COVID-19. Where possible, schools should implement cohorting of students and staff. Cohort should be 50 or less. Cohorting is not required in grades 10 to 12. Portable filters are recommended in classrooms that lack mechanical ventilation. Physical distancing is recommended in all areas, including staff rooms. Students are encouraged to select a small, consistent group of friends and colleagues to associate with in school and on buses. All students and staff eligible for vaccination should be fully immunized. And Minister Jamieson will be providing more details as well about the back-to-school plan. In addition, we have updated the Child Care Center guidance, and this information is being shared with operators today. As of December 31st, we have distributed approximately 250,000 rapid screening tests in P.E.I., which represents over 85% of our provincial stockpile. In January, we are expecting to receive over 460,000 additional rapid screening tests, 300,000 from the federal government, and approximately 162,000 from a private supplier. We are expecting our first shipment of just over 100,000 screening test kits from the federal government this week. These tests will be packaged and distributed to schools to ensure adequate tests are available for students and staff to support screening prior to the start of school and for the first week of in-class learning. Beginning today, we will be distributing rapid screening tests to early learning child care centers throughout the province to ensure that all children and staff, regardless of vaccine status, have access to rapid antigen screening tests, again, for the next few weeks. We have made a conscious decision to prioritize access to rapid antigen screening tests for children and youth and staff who work in early learning child care settings and schools. For the time being, we have diverted rapid antigen tests away from the Access P.E.I. sites. Similar to some other provinces, there will be limited public access to rapid screening test kits for the next few weeks. In future, as the supply of rapid tests improves, we will replenish the stock of these kits at Access P.E.I. sites. The increasing rates of COVID-19 highlights the importance of getting a booster dose of mRNA vaccine to provide protection against severe outcomes. Getting a booster at 6 months after your last dose provides you with longer term and additional protection, reducing the risk of hospitalization, especially for those 50 years and older. It is not necessary to get the same vaccine for your booster as you received for your first and second dose. You can book your booster 2 weeks prior to the 6-month anniversary of your last dose, example at 5 months and 2 weeks. It's interesting to note that in the month of January, over 45,000 people become eligible for their third dose or booster. An additional 2,000 vaccine appointments for booster doses are available in Summerside beginning tomorrow. These appointments will be released to the public today. Mass vaccine clinics will begin in early next week, with appointments being available later this week. Clinics will be moving to an expanded space in Summerside, and the Charlottetown Clinic will move back to the Eastlink Center. Pharmacies continue to add appointments and provide important access to COVID-19 vaccine to islanders and communities throughout the province. I know many parents are keen to have their children aged 5 to 11 years vaccinated. More appointments for children will be added in the coming days in Skip the Waiting Room, and there will be more pediatric clinics added this week and throughout the month of January. Health P.E.I. will be issuing a news release later today with more details about additional clinics and appointments and how to book appointments. Special thanks to Health P.E.I. staff and Canadian Health Labs for their planning and their work over the holidays to expand access to vaccine doses for adults and for children. I am optimistic that 2022 will be the year we find our new normal. It's just a hard way to start here in 2022. The year we transition from a pandemic to an endemic state where transmission is considered stable and where we really will be living with COVID-19, knowing it is circulating in our community. The high case counts and COVID-related challenges we are dealing with now are disheartening. It is hard not to feel discouraged. However, as the Premier mentioned earlier, it is important for us to remind ourselves that we are doing a lot of things well, and we have managed COVID-19 and its variants well. We have more active cases now than at any other point in the pandemic. And to all of the people currently in self-isolation because they are positive cases or close contacts, thank you for following the measures and limiting the spread. People can contract COVID-19 even though they are following all the guidelines, and there's no value in wondering, what did I do wrong? In many cases, people were diligent and respectful of the public health measures, and unfortunately, they ended up getting COVID-19. The Omicron variant is very transmissible and infectious, forcing us to do things differently, and this is, we've mentioned before, a very different phase of the pandemic. So it's interesting, I use that to weather the storm, and I know the Premier mentioned that too. We are going to weather this storm. We will get through this, and we will get through it together, and just like we've always done. And I think we all share that we want this to be over and put this behind us. But as we continue this journey through the storm with COVID-19, let us continue to be patient and continue to be kind. Thank you.
Thank you very much, Dr. Morrison. Great words as always. I'll now turn it over to Minister Jamieson, who joins us online virtually here. Over to you, Minister.
Thank you, Dr. Morrison and Premier King, and Happy New Year, everyone. I've heard from many parents and educators over the past few weeks, and I want to say these are difficult times and decisions we certainly do not take lightly. I am so impressed by the resiliency of students and young children over the past 23 months, the kindness of Islanders, and the patience of parents, guardians, staff, and educators. These are not easy times, but if we continue to follow the expert advice of the CPHO and Dr. Morrison, we know we can get through this together. Experts agree that the best place for our students and young children is in the classroom. The in-class experience is vital to the mental well-being and development of our young Islanders. Schools are so much more than a place to learn. It's where our students build friendships that last a lifetime, develop our life skills, access mental health supports, such as our student well-being teams, and have access to our safe, healthy, and affordable school lunch program. The Department of Education and Lifelong Learning, along with our educational authorities, have had many conversations with Dr. Morrison and the CPHO over the past week. Our collective goal has always been to get our students back to in-person learning as soon as it is safe to do so. We know that the health and well-being of our students and educational staff is at the foundation of all these decisions, and we thank Dr. Morrison for her guidance. At the recommendation of the CPHO, school will continue to provide remote learning for all students until at least Monday, January 17th. This extended period of online learning will allow rapid antigen tests and masks to be delivered to each school, allow students to monitor for symptoms since the holidays, and allow an opportunity for our schools to operationalize these enhanced guidelines that are being recommended by public health. It's an important reminder that we will continue to ask students and staff to stay home if you're not feeling well. As Dr. Morrison highlighted, her office has provided education with updated guidelines for enhanced public health measures within our school. We are working with the Public Schools Branch and the Commission Scolaire de la Langue Française to ensure that all of these measures are put in place prior to students returning to class. I'm pleased to report that we have 175 new portable HEPA filters. These portable ventilation units are being delivered this week to our 10 schools, which are relying on natural ventilation currently. And we're also working with the Department of Transportation and Infrastructure on providing new mechanical ventilation systems to these schools, starting this summer when classes are not in place. Work is also ongoing to ensure the current mechanical systems are maintained and working efficiently based on industry standards. We will also be delivering 30,000 triple layered cloth masks to schools for students and staff. Before returning to school, every student and staff will be supplied a triple layer reusable mask. The mask will provide enhanced protection for everyone. Strict hand hygiene procedures will continue in our schools, and we will be moving to cohorts where possible. Over the next 2 weeks, we will also be removing all excess furniture from classrooms to give more space for physical distancing. The Public Schools Branch has a COVID-19 response team in place to help support the preparations for the return to in-class learning. School operational plans will be updated this week. There is a meeting with administrators happening today, and we are planning a virtual town hall meeting for all educational stakeholders to discuss operational plans and implementing the guidelines provided by CPHO. Our goal throughout this process is to work together to support both students and our staff. These are challenging situations for everyone, and I want to extend my sincere appreciation to our educational staff across the province. In our early years sector, we commend the early childhood educators and staff who have worked throughout this fourth wave under enhanced public health measures. You continue to provide a safe and consistent environment for our youngest Islanders and their families. As a mom of 2 young children and on behalf of all Islanders, I thank you from the bottom of my heart. Prior to Christmas, the CPHO did provide enhanced public health measures for the early years sector, and this included having all staff masked and continued enhanced cleaning protocols. As Dr. Morrison had indicated, CPHO has further updated their guidance, which is being distributed today. Early learning and childcare centers will also be receiving triple layered masks for their staff, as well as additional rapid antigen tests for both children and staff. We are fortunate that many of our early years centers are relatively small, with group sizes that tend to be smaller than that of our public school classroom. This helps to decrease transmission of the virus and has enabled them to remain open and providing care for our youngest Islanders. To our early childhood educators and staff, thank you for your continued dedication to our youngest children and their families. And to our school staff, I know how busy you are today preparing for the transition to remote learning, and I thank you for the amazing support you provide to your students and their families. Thank you for your continued flexibility and commitment to education. And to our educational assistants and youth service workers, thank you for stepping up and providing respite care for students with special needs. And to all the administrative and support staff throughout the system, thank you very much. Learning, we will continue to offer respite programming. We'll continue to offer the school food program and social supports that our students require. Student services will be reaching out to families who have shown they have a need for respite care. We have a dedicated email address set up for families with children with special needs. And if you need respite supports, please send them a request and student services will follow up with you directly. As Dr. Morrison stated, once a decision is made to reopen school, which we hope will be January 17th, every student and staff person will be asked to have 2 negative rapid antigen tests prior to returning to school. We are working with the educational authorities on the best way to distribute these tests to families. We anticipate most schools will organize a drive-through where parents or caregivers will be able to drive by their school and pick up their test kits. These distribution plans are still being finalized, but parents can expect to hear from their school principals on the exact details for their school. I want to encourage all parents to take the next few weeks to get your children vaccinated, and I want to thank Dr. Morrison for providing an update on increased clinics starting this week. I certainly encourage everyone to get vaccinated. Finally, for families who may be struggling, I know that this is a long stretch for some households. I encourage you to reach out for support. Please don't hesitate to contact your school or your student well-being teams. That's what they're there for, and they're happy to help. There are also many provincial programs you can access from home, including Strongest Families program, Bridge the Gap, or when in doubt, simply call the Island Helpline at 1-800-218-2885. It's toll-free, it's confidential, and available 24/7. The 211 emergency isolation supports will also continue, providing assistance with food, personal prescriptions, over-the-counter medications, and other emergency situations. In closing, I know remote learning is not ideal, but it will help to keep our children and our community safe as we work through this fourth wave. We do have resources on our website to help parents in remote learning. There's a remote learning guide as well as frequently asked questions. But if you are feeling overwhelmed, please reach out to your teachers, talk to your principals. We want to work with you. Every family situation is certainly different, and remote learning can be challenging. Do your best you can, and please reach out when you need support. I want to thank everyone for your continued patience and your perseverance. We will get through this. I'll hand it back over to Premier King. Thanks again.
Well, thank you very much, Minister. And like our previous couple of briefings, a lot of information's packed into that. So we will try our best to unfurl as much of it as we can with our friends in the media. Maybe we'll start with Alison here from The Guardian.
Thank you. I guess the first question would just be about any vaccine clinics in schools. Will they continue to operate or be ramped up, or is it just community clinics?
Hi, Alison. So at this point, what Health P.E.I. has talked about, it was really public health nursing. The plan was to go and do some clinics in school. I think given the need to try to get as many young people their first doses of vaccine, and also the need to booster so many others, that they really would like to focus on some more clinics, pediatric clinics in the community. And that's not to say the other in-school won't happen, but certainly at this point the focus is going to be on having pediatric clinics really from a human resource point of view and efficiency point of view. But and that will be the focus, and it will even make sense over the next couple of weeks as well.
Yeah, the empty schools aren't an opportunity to set up a clinic when there's already one in the community. That can be extra.
Yeah.
Perfect. Okay. And I did have a question. I'm trying to think. I know this briefing is mostly schools. I did have some questions about workplace outbreaks. Is that something that we can chat about? Basically just, it sounds like there's some efforts from public health to supply masks to the students and the schools and staff. Will that continue on to workplaces, perhaps?
Well, I mean, I don't think we've been planning necessarily for workplaces in terms of providing masks, or not. That hasn't been part of our discussion in the last few days. But I think one of the things that we're trying to have available on the website, and I'll speak more about it on Thursday, is around the test to stay for workplaces. So I think there's that part where certain critical infrastructure workplaces who may have identified an outbreak in their facility, how we that there are close contacts that can really work isolate. So that we'll talk more about that later in the week, and hopefully that will be available. The other thing that is we've talked about, I think before, but for small and medium businesses, they've been able to make application to access rapid antigen tests. And so that has been ongoing. And I think that supply may have been depleted as of today, but we're hoping that by the first of next week, the federal government, who's involved in that small medium business distribution of rapid antigen tests, will have an update on that before the beginning of next week. So that should be able to continue then, starting on Monday.
Excellent. As far as long-term care and hospitalizations, I know there had been a surge plan in the past for any outbreaks in long-term care facilities to, move them to the old Riverside Manor. We were wondering if any of the hospitalizations are people from long-term care. We try not to do too many details about any of the particular patients in hospital, but certainly the patients that are currently being treated for COVID-19, I believe none of them came from long-term care, so they weren't transferred to the hospital from long-term care. But I think there's certainly ongoing, in terms of plans, most either residents, if they do get COVID, will be treated in place, and that's certainly part of the planning around long-term care. Okay. And can you clarify the numbers of people in hospital? There were 3 in hospital for COVID, 1 in ICU. So is that including 1 in ICU?
So, yes. So one of the 3 being treated for COVID has been in the ICU.
Okay. And one more, if you could remind us, we're prepared with enough ventilators. We did get extra ones, I think, in 2020. Mm-hmm. Is that correct?
Yes. And Allison, I think Marion Dowling may have spoken about the number of ventilators last week, and I don't have them in front of me, but I believe it was. I don't want to misquote her, so we can send those to you. But yeah, exactly.
Yeah, that's it.
Thanks.
Thank you, Allison. Now we'll move to those of us who have joined us virtually or online. So maybe we can start there.
Steve Bruce, CBC.
Yes, hello to you all, and Happy New Year. A few questions around schools. You talked about all the things you'll be doing over the next couple of weeks now to try to make schools safer, getting the rapid test to students, installing the HEPA filters, dishing out the 30,000 triple-layered masks, making more space for physical distancing. So if all that stuff was already in place now, would you be opening schools now rather than on the 17th?
No. Hi, Steve. It's Heather. I guess you know. But it's we're looking at the situation, and I think I tried to reference it. I mean, we're looking at the Omicron variant wave situation here, and we're just seeing increasing numbers in the last week in this province, and I think the next period of time, sort of from the 8th to the 17th, gives us more time to see the impact of the wave in our community, and right across the province. So I think these other things that you mentioned that we have put in place as recommendations are additional layers of protection to minimize, not to, like I mentioned, it's not going to prevent all cases or outbreaks, but it should reduce that. But it's the fact that we are still seeing a steady rise in our cases.
And I'm sure some parents will see the decision to delay even further maybe as an indication that schools at this point are not safe and that their kids would be at a real health risk if they did get Omicron. So what can you say at this point about what you know when it comes to the health outcomes for children with Omicron in particular? And I guess how much does vaccination status matter with that?
Well, I mean, both good questions. So I think we're still learning more about the impact of Omicron on children, but certainly what we have seen across the board in terms of COVID and its hospitalizations, it does not seem to have severe outcomes or the hospitalization rates in younger people as it has had in the older population throughout COVID and including the last number of weeks. So those were the kinds of questions I think, Steve, we thought would be really useful for the town hall as well when we bring in some of the educators, and I know that will be information for parents as well, looking at the precise rate of hospitalization in different age groups that we are seeing. The vaccination rate, certainly, right now it's 42% of those age, or 41.9% of those age 5 to 11 who've had one dose of vaccine. Certainly like to see 50% of our eligible children between 5 and 11 have their first dose of vaccine before they get back to school. And we have, continuing rates that are really good. I don't have it in front of me, Steve, but we can certainly provide it, the rate of overall vaccination rate between those who are 12 and 17 who are fully vaccinated already. So I think it is very important. We know that with Omicron, the transmissibility, we've talked about that, is much higher than with the previous Delta wave. But we do know that vaccination does decrease your rate of severe outcomes or your chance of being hospitalized.
Thanks. And a question for the Premier or Minister Jamieson. Obviously, when you keep schools closed for 2 weeks or more, that has a real impact for families, for parents. So is there anything in particular in place for how the province will support parents that are trying to work from home and look after their kids, or are in need of childcare now, who maybe can't work because they need to stay home with their kids?
I think I'll turn it over to the minister. In her statement, she outlined a number of the programs that we have in place designed just to do that. And maybe, Minister, if you want to just go over those again.
Hi, hope you can hear me. Yeah, thanks for the question. Certainly our respite care for families who are feeling like they need that additional support, please reach out to Student Services, or Student Services may also be reaching out to your family directly if the principals or teachers have indicated that your child may need that additional support. Also 211, if you're requiring some additional financial supports, please don't hesitate to reach out to 211. They certainly have avenues into all of our various community programs here and are able to direct you accordingly.
Thanks, and maybe one more question for Norbert Carpenter. In terms of the online learning now over the next 2 weeks, but possibly beyond, what will the expectations be this time around in terms of how much time students are spending? What the expectations will be as compared to past times when students have been home and doing online learning.
Hi, Steve, and thanks for the question. We are in the process right now of having the remote learning take place this week and into next week, and we're hoping to be back by the 17th. Teachers today and tomorrow will be sending out emails to parents with the expectations. It does vary by grade level, so the K to 3, 4 to 6, and the different key stages. You may see some expectations like a period of time dedicated to synchronous learning, live lessons with the teacher, some independent work in between, but each grade level or key stage will have a dedicated set of expectations for the children they teach.
Thanks. And maybe if I could sneak one more question in, just a point of clarity for Minister Jamieson. You talked about respite care being provided, but is that, to be clear, is that just for families who have children with special needs? And then obviously there's lots of parents that will still need some level of support when it comes to childcare, or if they're unable to work because they need to look after their kids. So, is there anything in place for those families?
Yeah, thanks, Steve, for the question. And we recognize that this is a challenging time for families. Having 2 small kids myself, I understand the importance of childcare, and I do want to commend our early learning and childcare centers for stepping up over the last 23 months. They're incredible. Yes, our respite care is for our students with specialized needs. We are currently looking at some options to make available to families who require childcare for those school-age children. Certainly, we encourage employers to be flexible. We've said that from the beginning. It is a challenging time, and really encourage employers to be flexible. Also, a time to lean in on family and friends. I know my parents, again, speaking from personal experience, my parents have stepped up to the plate and have supported me beyond measure. So I know this is exhausting and frustrating, and I really empathize with families. But I know we can get through this together.
Okay, thanks to you all.
And Steve, if I could just add, that a lot of the programs that we had previously announced were designed to try to be from a more generic, across the board, to try to help as many as we can to fill the gaps with some of those federal programs. But the some parents that you might outline there would, if they can't get to work, there are supports for them to be able to stay at home, for example. But when you're developing programs for 165,000 people, it's hard to get everybody. So that's why we have instituted the 211 line, for example. There might be a family or two that don't quite fall into the direct boxes, but we want to try to be as helpful as we can. And so that's when the minister outlined some of that in her introduction to those programs. We're really trying to do everything we can, as much as we can, for everybody. And if you find you don't fit into one of these programs directly, please contact us through 211, and we'll try to help as much as we can to get people through this.
Understood. Thanks so much.
Thank you.
Neepy, The Guardian.
Hi, everybody. Good afternoon. I guess first question, I
Stu.
recall the last briefing we had, there was a lot of talk of P.E.I.'s back-to-school plan being similar to Nova Scotia's. Looks like Nova Scotia's going back to school on January 10th. So why is there a difference then, I guess, than Nova Scotia's back-to-school plan?
Oh, well, Stu, I'll start. I mean, I think when I answered that question, I said we didn't commit to a date, and we haven't. Dr. Morrison has talked about a lot of the factors that are weighing into this. We want to make sure and take as much time as we can to see what the impacts, if any, or if they're higher because of the holidays that we just went through. I know holidays are a time for more people to gather, for example. We've had more people traveling into the province because of that, so we're trying to take a cautious approach. This has never been, although we try to mirror the best we can based on the science we use, this has never really been a race or a competition, or just because someone is doing something that we would do it. This is what we have been talking about the last few days, and this is where the science leads us, and we're hoping to get them back in January 17th.
Okay. Just a couple questions on I guess testing. So last briefing we talked a little bit. I guess this is for Dr. Morrison. You had mentioned that there were some issues with COVID-19 PCR test lab capacity. So it sort of seems most of the testing now at the drive-in spots and at the points of entry, they're the ID now molecular rapid tests. So wondering if you can tell me a little bit more about that PCR testing capacity, what the issues were and why it's been so low.
Hi, Stu. Happy New Year. So I think a couple things. One, we're in a fortunate position in that we have some testing options that are really good with the molecular tests, and with slightly increasing prevalence, with increasing prevalence in the population, our sensitivity or pretest probability for the molecular ID Now machine tests are really good. They're approaching PCR sensitivity. So that's why we can use them even more than we could before. I think we had, there was lab capacity issues in terms of even staffing for a couple of days. That has resolved. And I think you probably have seen, Stu, right across the country, really wanting to focus the PCR tests more specifically on certain populations. So, in fact, we are in the process of reviewing who basically should be getting PCR tests, and that is being reviewed with Health P.E.I. And it means that, for instance, those who are being admitted to hospital, those in long-term care would get a PCR test, and those who would be presenting to clinics may be getting the ID Now tests, which in many ways is the turnaround time for the ID Now tests is very, very good. So it's trying to use both of them, and I imagine we'll see a bit more PCR-based testing over the next couple of weeks, but we want to make sure that they're able to have the capacity to do the tests for inpatients and other high-risk and more vulnerable folks. I didn't speak about it but I'm anticipating you may have another testing question around the percent positivity, and that's the percentage of the tests that are positive. And really looks at, it's focused on who you're testing. And overall, between the PCR and the molecular point of care tests, which are being conducted, and those are for symptomatic individuals, close contacts, and those who've had a preliminary positive on an antigen test, the overall percent positivity is 10.9%. And I know, and that's calculated really on a daily basis, but that is over the last 7 days. So we'll continue to update that.
Okay, thank you for that. So one thing that was mentioned, Dr. Morrison, was the stockpile of rapid tests was between 15,000 and 20,000 as of late last week. But how much of that stockpile are the ID Now tests, and how much are the actual take-home rapid tests, rapid antigen tests?
That stockpile we were referring to is all, it's pretty well all our rapid antigen tests, and it's almost all been distributed with the distribution to early learning centers today of some rapid antigen tests.
Okay, so in other words, there's not really a shortage of the ID Now.
No, not at all. We're in a fortunate position in that way.
Okay, I'm just wondering. I guess this would be more for Premier King. So we have the first shipment of 100,000 rapid tests from the federal government coming next week. But when does the province expect to receive its shipment of tests that are being purchased using provincial dollars?
Do you want to? Yeah.
Stu, I may just jump in here because I was on a call earlier today. We are hoping that in addition to the anticipated federal supply shipment, that we should get our private supplier has indicated a date of the 15th. But again, that's in this country where everyone is looking for those antigen tests, we won't count on them until they arrive.
I see. Okay, so I'm understanding that the the next week is the private shipment as opposed to the federal shipment.
So we have not heard any confirmation about, we have the federal shipment that's arriving this week, which we'll be using for the schools. And then we have not had a date confirmed for the remaining federal shipments for the month of January, but we have had confirmation that they will be delivered, but we do not have dates. And then the private company shipment, which is in addition to the federal government one, is we were given a date of the 15th of January for that.
Okay, last question. So the most recent, I guess, shipment of rapid antigen tests from the federal government in December, was this shipment increased from months prior, I guess, what with the possibility of the arrival of Omicron?
Yes. We had requested and received additional antigen tests in December.
Can you tell me how many of the rapid antigen tests?
Stu, I'm not sure I know off the top of my head. I believe it was 80,000 that we had requested in addition.
Okay. How much higher was that than, say, like November's shipment?
I know it was at least, I believe it was double, but Stu, I'll have to have all those numbers. I don't have all those numbers in front of me from November, what the November shipment was, but I know you like to know all those details, so we can certainly get them for you.
Thank you very much.
Thank you, Stu.
Martin, CBC. Hi, good afternoon and Happy New Year to all of you on the line today. Dr. Morrison, you just mentioned the positivity rate is 10.9% on Prince Edward Island. Can you help us understand why that is an important metric to watch?
Well, I think it's one metric, Louise, but it's you have to be certainly cautious when you look at it, because I also want to look at making sure that enough people are being tested, because it will be very much influenced, that percent positivity, if you're not testing many people and you're only testing a smaller number who have symptoms. So, but I think it's one more measure that we continue to look at. It's an indication of your level of community transmission, and that's certainly why it's been used as a measure across the country, probably more so by other provinces who had higher numbers in previous waves. And so it's something that we are monitoring here, both between the PCR and their point of care tests. And but it reflects that percentage of tests that are positive, but it's also influenced by who is getting tested as well.
When I hear the changes coming to who is being tested and maybe PCR tests only being used in hospital settings as we transition, does that mean eventually, or in even the nearer term, we will just stop reporting case numbers if the most important data now is really severe illness and hospitalization?
Louise, I think that's a very good question, but and I think that's eventually where we will end up. But at this point in time, it's very important for us to do good surveillance. I think it influences our indicators, that our metrics that we're looking at to plan our way out of these measures and transition from pandemic to endemic. So as much as we are able to continue to do testing of individuals using our different testing capacities, I think it will be important. We also report all our numbers, of course, nationally, which give part of that national picture, but more importantly, it helps give us some indications here, and I think testing obviously all the time has its limitations, but we'll continue to do so here, knowing that eventually, Louise, we'll get to a point where we will only be testing those who are probably ill enough to be admitted to hospital or who are presenting for care in an emergency department. And at that point, I hope that and the Premier and I are both not here talking about Omicron or COVID in the same way.
You speak about, in the Premier too, about the mild symptoms, particularly for those who are vaccinated, and the importance of getting vaccinated to prevent you from getting seriously ill or in the hospital. So can you tell us the immunization status, the vaccination status of the individuals who are in hospital? And if you can't for privacy reasons, can you tell us if any vaccinated individuals are in hospital with COVID-19?
Louise, I did discuss this with Dr. Cameron, our epidemiologist working on COVID, and it is part of the surveillance and the epi policy not to give the vaccination status for when we have less than 5 people in hospital, but when we start having numbers that are bigger than that, we will be speaking about the vaccination status of individuals in hospital.
Okay, thank you. And then given that doctors in other regions have said the case numbers rising, lags the number of people in hospital, are you worried that saying the symptoms are mild offers Islanders maybe a false sense of security, given that those numbers lag hospitalizations?
Well, I mean, I think we've talked about it over the last number of weeks, that the majority of people certainly have mild to moderate symptoms. We do know that people are presenting to emergency department, even though they're not getting admitted necessarily, they are presenting with symptoms that are making them seek care. I think we have about 90% of individuals who do get COVID who do have symptoms, which is a higher percentage than we've seen in other waves or other variants. But you're absolutely right, Louise. There's a lag in terms of the volume of cases and the number of cases and where you see the rise in hospitalizations, which speaks to why we have to do everything we can as Islanders now to try to limit the spread, not prevent it, but limit that spread so that we don't have that high rise in cases, which will likely then mean that there will be a higher number of people admitted to hospital.
Thank you very much.
You're welcome.
Pascal Rachinogu, Radio Canada.
Oui, bonjour. Ma question est pour la Dr. Morrison. Si vous pouvez l'expliquer en français, qu'est-ce qui motive votre décision de limiter l'accès aux tests rapides dans les centres de Access P.E.I pour concentrer les tests rapides dans le système scolaire? Qu'est-ce qui a motivé votre décision?
Bonjour Pascal. Alors c'est vraiment couple de facteurs. On a les cliniques pour faire les tests. D'autre part, c'est pas seulement les tests rapides. On veut qu'on fait comme une priorité pour essayer de diminuer l'impact de COVID dans les écoles et pour les étudiants et les enseignants. Alors, on veut faire vraiment les mettre là-bas. Ça ne veut pas dire qu'on n'a pas les tests rapides aussi au point d'entrée. On a les tests rapides. Vient de parler pour les business qui sont, il y en a accès pour les tests rapides là-bas. Alors, c'est pas seulement les écoles, mais ceux qui restent, on veut, c'est tellement important de vraiment que les étudiants retournent, tous nos enfants retournent à l'école. Alors, c'est une décision qu'on fait. Et puis, quand on a plus de tests rapides, on va les distribuer encore partout au point d'accès.
Est-ce que je sais que dans certaines provinces, l'accès aux tests rapides est difficile parce qu'il y a beaucoup de demandes. Donc, il y a énormément de demandes et les gens allaient chercher beaucoup de tests. est-ce que c'est ce qui se passe à l'Éduc-Prince-Édouard? Est-ce que l'idée, c'est un peu de faire qu'il y ait des tests disponibles pour les personnes les plus vulnérables, les endroits les plus nécessaires?
Parce que depuis le début, avec un certain montant de tests rapides, on a toujours vraiment on a décidé de les faire plus accès où les personnes sont plus vulnérables. Alors, on a fait pour les tests rapides pour les personnes qui sont tested ou vaccinées. On a fait l'accès pour les tests rapides pour les personnes qui travaillent à les foyers de longue durée. Pour qu'ils peuvent avoir plus de tests là-bas. On a fait accès pour les personnes qui viennent de rentrer à l'Île-du-Prince-Édouard. Alors, on a toujours fait des décisions d'essayer de les mettre où on pensait qu'il y avait plus de risques pour protéger les gens qui sont plus à risque.
Merci.
Merci.
Felix Arsenault, Radio-Canada.
Oui, merci. Ma question, ça serait pour la docteure Morrison ou pour la ministre Jamieson, si c'est possible en français. On a vu la Fédération des enseignants demander hier que la rentrée soit repoussée en classe au 17. Est-ce que c'est un peu à cause de cela que le retour est repoussé ou c'est vraiment la situation comme telle qui le demande?
Bonjour Félix. Est-ce que vous pouvez répéter? Je ne comprends pas ton question.
Oui. On a vu que la Fédération des enseignants demander hier que la rentrée soit repoussée, la rentrée en classe soit repoussée au 17, et là, vous annoncez ça aujourd'hui aussi. Est-ce que c'est un peu à cause de cela ou c'est vraiment la situation avec le variant Omicron et tout ça qui demande que ça soit repoussé?
C'est vraiment la situation de l'Omicron qui fait la décision, pas le statement de Teachers Federation. Et puis, je sais qu'on vient de parler, de faire cette décision avec le Premier ministre il y a avant-hier, bien sûr. Minister Jamieson, the question was, did the statement from the Teachers Federation, was that what made our decision to extend the date about the in-class learning? And I said, no, it was based on the Omicron situation, and that discussion had taken place with the Premier well before yesterday.
Thank you, Dr. Morrison, and certainly appreciate the position of the Teachers Federation and all Islanders. But I agreed, we've been in these discussions now for a number of days and weeks. So.
En fait, j'aurais peut-être une autre question. Je crois que M. Arsenault là, du conseil scolaire est aussi en ligne, là, si j'ai bien compris au début. Ma question, ça serait de comment ça va se passer un peu dans les écoles avec ces nouvelles mesures, les 2 tests rapides avant de pouvoir revenir en classe, les 3 tests par semaine là, pour certains. Comment est-ce que ça va se passer et comment est-ce qu'on se sent dans les écoles avec ces mesures-là?
Gilles?
Oui, est-ce que vous m'entendez?
Oui.
Oui, merci pour la question. Puis oui, dans les écoles de langue française, comme dans les écoles de la Public School Branch, on va être très content de participer à coordonner la distribution des tests rapides qu'on va pouvoir faire avec nos familles, avec les élèves. Alors, on va voir ça et aussi le port du masque, on va être en mesure de distribuer. Alors, pour nous, ça va commencer aussitôt qu'on va recevoir les tests et les masques. Alors, on va être en mesure de coordonner et après cette conférence de presse, on a une rencontre avec les directions d'école pour finaliser notre plan de distribution. Alors, on pense pas que ça va être problématique. On va encourager les gens de venir ramasser les tests et les masques, pouvoir mettre les mesures en place pour respecter les consignes, les nouvelles consignes qu'il va avoir pour au retour à l'école en personne, on espère le 17 janvier.
Parfait, merci beaucoup. Thank you.
Jessica Dory Brown, CBC. Hi, everyone. I just have a few short questions for you. I know it's been a long briefing. My first one is, At the briefing yesterday, I believe it was said there would be 300 rapid tests coming federally, 300,000 coming from the feds, 300,000 from a private supplier. And now it seems that that number from the private supplier has gone down. So just a kind of confirmation on that, and if so, why, and will this be enough? Will we have enough tests?
So, hi, Jessica. So if I, for right along, we weren't ordering 300,000 tests privately, but it was definitely 300,000 tests from the federal government that were expected this month, and only sort of over 100,000 expected privately, and we ordered that over 150,000. So if I said it incorrectly, but I think that was in my notes last time, so I apologize if that was unclear last time. So it's actually, there's been no change, and we're still confirming the dates and the first part of that shipment arriving this week of 100,000.
Okay, sorry, I must have noted that down wrong, but will that be enough?
Well, I mean, we've looked at how many students there are in K-12, and as well as how many staff, and tried to figure out how many we would need if we gave each of them two before they went back to class, and calculated that out for the first 2 to 3 weeks, and hopefully that's based on what we know now, we should have enough.
Okay, my next question is just for some clarity on the masks for school children and staff. Will there be one 3-layer mask for each student and staff member, or will there be additional masks in some cases?
Minister Jamieson, maybe I'll let you take that.
Thanks for the question, Jessica. Yes, the intention is to provide all staff and students with one 3-layer mask at the beginning of when they go back. Certainly we'll have extra at the school level if they're required, but that's what we'll start with, and again have some additional available.
Okay, thank you. Over in New Brunswick, they're now saying vaccinated people who test positive for COVID now have to only isolate for 5 days, while unvaccinated individuals have to isolate for 10. So we're curious what P.E.I's thinking is on this.
Hi, so I think I indicated at the beginning that we'll be talking about that at another briefing on Thursday. We just felt like this was more focused on education, and there'll be an updated information about case and contact isolation on Thursday when we come back out.
Okay, and last question for me is just about hospital capacity for, say, individuals being treated for COVID. What is that capacity? How many hospitalizations do we have to have before we hit that?
I think it's probably an answer that we'll probably be able to send to you from Health P.E.I. I don't want to speak for them, but certainly at this point, based on the information I have, they have capacity there, and I've heard Dr. Gardam said they're doing well from a capacity point of view at this point in time, but we can certainly get that information sent to you.
And some of the contingencies.
Okay, thank you, everyone.
Jessica, just to finish off, some of the contingencies that obviously they have in place within our hospitals are, we're trying not to, cancel some of the surgeries, et cetera, that they're seeing in other places. But as the hospitalizations increase, if they do, I mean, those are types of the things that could get impacted. But I think Dr. Morrison is right on. So far, we're able to deal with the capacity right now. But I mean, we went into COVID 22 months ago knowing that we have some challenges within the delivery of healthcare all across the board, and certainly COVID hasn't helped that, and we don't anticipate that the Omicron variant is going to help that as well. But so far we're in a good place. There's confidence from Dr. Gardam and his team that we're in a good place here, but we'll just evaluate it daily.
All right, thanks a lot.
Thank you very much. Well, I think that brings an end to our questions from our friends in the media. I want to thank Minister Jamieson I want to thank Norbert and Jills, who joined us to assist with the technical briefing, and as always, Dr. Morrison and her staff. So to all Islanders, again, Happy New Year and stay safe.